Hey, welcome everyone. Today we talk about urinary tract infections. So, what are the subtypes of urinary tract infections? Could be asymptomatic bacteriuria, could be asymptomatic bacteriuria in a pregnancy, could be cystitis, could be pyelonephritis, could be perinephric abscess. How do we manage each? So if it's asymptomatic bacteriuria, usually it's just when you do UA for screening purposes and happen to be positive, just positive UA. So that when you do that, no treatment. That's what we do. Asymptomatic bacteriuria, if it's in pregnancy, where do we do that? Same thing, asymptomatic screen. What do you do? Urinalysis shows leukocyte esterase and nitrate. And urine culture could be positive too. What do you do that if it was a pregnant woman? So the same thing, let's just add. If it's pregnant, what do you do that? You give amoxicillin, because you don't want to cause a problem to the baby. If they are allergic to amoxicillin, then you do nitrofurantoin. And then follow up, you just rescreen. Rescreen again, okay? Again. So this case we remove that because it's an asymptomatic bacteria. Now for cystitis, what do we do for cystitis? Let's do that. So for cystitis, it's a bladder infection due to gram-negative organisms, bladder infection. How does it present? Frequency, urgency, dysuria. Frequency, urgency, dysuria. And then how do you diagnose that? Diagnose that urinalysis plus urine culture. That's what you can do. How do you treat it though? You treat it, if it's uncomplicated, just give them 3 days. Just you treat for 3 days with TMP, SMX or nitrofurantoin or anything like that. If it is complicated, like complicated mean if it's penis, if it's their plastic, like a Foley catheter or something, or if there's a procedure, or ambulatory pyelonephritis. So 4 P's: penis, plastic, procedure, pilot. Penis means if it's in man, that's complicated already. How do you treat it? Same thing, amoxicillin, nitrofurantoin, and TMP, SMX. Okay. Amoxicillin, if allergic, you do nitro. If you can do TMP, SMX too. If you don't want to give it amoxicillin or nitrofurantoin. That's it for a cystitis. How about for a pyelonephritis? What do we do? Let me bring it here. Pyelonephritis, how do we do? It's an infection of the kidney, we know that. They present with, the only difference that it's present with the frequency, urgency, and dysuria, plus nausea, vomiting, and severe tenderness, because it is a systemic infection. So while urinalysis, you see urinalysis, you see white BC cast, and then you do urine culture, and you do blood culture. That's an important thing to do. And then what do? You want to give IV antibiotics, ceftriaxone or ampicillin sulbactam, ceftriaxone or ampicillin sulbactam for 10 days treatment. That's a pyelonephritis. How about perinephric abscess? How do we treat that? Usually walled off kidney infection. So it's pyelonephritis that doesn't improve, doesn't get better. What do you do for that? You do CT scan or ultrasound. And then what do? You do incision and drainage plus antibiotic for 14 days. And that's basically a summary of urinary tract infections. That's the summary for urinary tract infections. So urinary tract infections, if it's asymptomatic, you don't treat unless it's pregnant. Cystitis, there is no nausea and vomiting. Pyelonephritis have nausea and vomiting. If it's uncomplicated cystitis, for 3 days. If it's complicated, you do it for a little bit longer, 7 days. Pyelonephritis, you do urine culture, blood culture, and you give ceftriaxone or ampicillin sulbactam for 10 days. Perinephric Abscess, CT scan, incision and drainage. This is urinary tract. Now let's take this opportunity to talk about genital ulcers too. Let's add the genital ulcers plus genital ulcers. So genital ulcers could be caused by syphilis. Syphilis, what is caused? Caused usually by Treponema pallidum. There are different types of syphilis. It could be primary, which is single painless ulcer with lymphadenopathy. It could be secondary when there's rash, fever, targetoid lesion on palms and soles. Could be tertiary if there is a neurologic symptom. So how do you diagnose it? It could be primary, just painless ulcer. Could be secondary, rash and fever, palms and soles, targetoid lesion. Could be tertiary, neuro symptoms. How do you diagnose the primary? You do dark field microscopy because it's very small, so you need some dark environment to see well. If it's secondary, you do RPR and then you confirm it with FTA antibodies. If it's tertiary, then you do RPR and then you do lumbar puncture with CSF, RPR and FTA antibodies. How do you treat it? If it's primary, you give penicillin IM 1 time only. If it's secondary, then you give penicillin IM 1 week, once a week, for 3 weeks. If it's tertiary, then you give penicillin IV for 14 days. What if they are allergic to penicillin? If penicillin allergy, if allergic to penicillin, let's do it here. If allergic to penicillin, then you do doxycycline. What if a pregnant and allergic to penicillin? What if allergic to penicillin, add pregnant to it? Then you do penicillin desensitization because doxycycline is teratogenic for a pregnant woman. And then you do there's Jerris examen reaction. Your fever and symptom worsen after treatment, so you just give aspirin. There's this Jerris examen reaction. Symptom worsen after treatment, you give him aspirin. Okay, so that's it for the syphilis. How about Haemophilus ducreyi? How do you treat that? Haemophilus ducreyi. Ducreyi is do cry, so it's a gram negative that make you cry. Painful ulcer, single painful ulcer with lymphadenopathy. That's it. Single painful ulcer with lymphadenopathy, while this one single painless ulcer with lymphadenopathy. The only difference between syphilis and haemophilus is painless, painful. How do you diagnose it? You do gram negative stain and culture, and you give azithromycin, or you can give ciprofloxacin. Take care of that. How about herpes, HSV, herpes simplex? It's a virus that hides in the dorsal root ganglion, usually painful, burning prodrome, and then you develop multiple vesicles on an erythematous base, and that may And these multiple lesions may coalesce to look like one ulcer, and there is no lymphadenopathy. That's very important. Lymphadenopathy. It's important. How do you diagnose it? You diagnose it clinically. Clinical. Or you can do HSV PCR. And then you treat it with a cyclovir. That's it for a herpes simplex virus. How about Molluscum Contagiosum? Usually it's self-limited infection. There will be central umbilication, multiple vesicles. You diagnose a clinical and you treat by freezing them off. It's cryotherapy. Molluscum Contagiosum. How about lymph granuloma venereum? This is usually caused by chlamydia trachomatis. The way it present with painless singular ulcer with painful suppurative lymphadenopathy. Usual diagnosis clinical, or you can do nucleic acid amplification test if needed, and then you treat it with doxycycline. And that's it, genital ulcers. So to summarize genital ulcers, if it's a single painless ulcer without lymphadenopathy, this is syphilis, you just give them penicillin shots, it's fine. If there's rash on palms and soles, you give them penicillin for once weekly for 3 weeks. If there's a neurological manifestation with syphilis, you confirm a lumbar puncture, you give penicillin for 14 days. If they're allergic to penicillin, doxycycline. Unless they are pregnant, then you do penicillin desensitization. Usually symptom could worse with penicillin therapy because of destruction of bacteria, so you give them aspirin. Haemophilus ducrei is the opposite. The only difference is a single painful ulcer with lymphadenopathy. While syphilis is single painless. That's the only difference, painless, painful. This one you do gram-negative and culture and you treat it with azithromycin or Cipro. HSV, usually painful burning prodrome, the multiple vesicle erythematous space, make a less to look like one ulcer. But there is no lymphadenopathy, that's the difference. And you treat it with a cyclovir. This one is azithromycin, this one penicillin. Haemophilus ducrei, usually central umbilication with multiple vesicle. Molluscum contagiosum. Okay, central umbilication. So what do? You just freeze them off, cryotherapy. Lymphogranuloma venereum, usually doxycycline, is painless singular ulcer with painful suppurative lymphadenopathy. So it looks like a same thing, painless singular ulcer, but there's suppurative lymphadenopathy, painful lymphadenopathy. Syphilis, there's no painful lymphadenopathy. That is the difference. And that is the summary for urinary tract infections and genital ulcers. Thank you so much for listening, and we'll see you on the next one.